Today we are specifically talking about incontinence and stress incontinence in particular right now. There's a myth involved with stress incontinence or urinary leakage associated with stressors like jumping, coughing, lifting, etc. And that myth is that you just need to perform Kegel exercises if you're leaking. But the truth is, first you need to find out why you're leaking when stressors occur. It can either be because your pelvic floor muscles are too tight or too loose, and so you really need to be evaluated by a pelvic floor therapist, which we're happy to help with, to find out first why the stressors are causing the urinary leakage. But I do want to give you one tip if you are having leakage with lifting, laughing, jumping, etc. And that tip is lifting without leaking. First, I'll just give you a brief illustration of how your abdominal cavity works. If you can imagine it as a balloon with your lungs at the top, abdominals at the front, pelvic floor muscles at the bottom, and your spine at the back. When you lift, pressure increases in this cavity, and pressure will go to the weakest area, which, if you are weak in the pelvic floor muscles, will cause urinary leakage. And so one way to lift without leaking is to exhale when you lift. When you exhale, pressure can go up into the lungs instead of down into the pelvic floor, causing leakage. So when you go to lift an item, grab it, use good body mechanics, and exhale as you lift. And that will help prevent leakage when lifting.
Awesome, thank you. That is one great technique you can start using today to help stop leakage as you try to move around. And remember what Dr. Rachel Atkins said, really if you're having an issue, you need to seek out skilled, trained assistance to help figure out what's going on. And here at Fyzical, we have Dr. Rachel, who is our specialist in this area. She can help you figure out what's wrong and help you learn how to resolve that issue to help you, again, remember to love your life. That's why we're here.